Hey everyone, Ryan Smith at Better Life Carolinas again. So we've talked a bit about declining testosterone levels that men experience, this andropause or androdecline. We've talked about how it can influence risk for metabolic disease. Let's talk now about how these declining testosterone levels can impact our risk for heart disease. This is the real deal. Heart disease is the number one killer for both men and women. And there does appear to be a pretty consistent correlation between declining testosterone levels and risk for heart disease. So let's look at that. We know that low testosterone levels are consistently associated with an increased risk for cardiovascular disease. There is an increase in mortality from cardiovascular disease in association with low testosterone. One striking figure came from a study that showed that in men under the age of 45 with low testosterone, their risk for premature heart disease was increased by 3.3 times that of men with normal testosterone levels. So we've established that low testosterone is associated with increased risk for heart disease. What happens if we optimize those levels, if we replace testosterone? So the most compelling statement I can make about how testosterone relates to heart disease risk is that increases in serum testosterone, what we check in your blood, to optimal levels is associated with a decrease in all-cause mortality. Full stop. What that means is that if we can optimize testosterone, your risk of dying for any reason goes down. That's a telling statement, and everything else that I'll say really falls under that general principle, okay? Now, we have a number of studies that have looked at the way that testosterone might affect heart disease risk, but the key thing to remember is that we have established this relationship that optimal levels of testosterone are associated with a decreased risk of dying for any reason. We know from some studies that testosterone replacement therapy appears to dilate coronary arteries. Those are the arteries that carry blood to our heart muscle. And if we can dilate those arteries, we're increasing blood flow, and that's cardioprotective. That's one proposed mechanism for how testosterone may be beneficial. We also know from other studies that testosterone replacement appears to modulate metabolic risk factors. We talked about this in the last session. Glucose levels, cholesterol levels, LDL cholesterol in particular, appear to be lowered by testosterone. Other studies have demonstrated a reduction in inflammatory markers with testosterone. Inflammation is another key part of heart disease, and we have good evidence that testosterone decreases tumor necrosis factor alpha, interleukin 1b. These are pro-inflammatory cell signals. And testosterone seems to increase anti-inflammatory signals like interleukin 10. Lastly, we have studies that demonstrate how testosterone improves exercise capacity in patients who have heart failure. So this just demonstrates that it might improve the efficiency of the heart muscle itself. So is there evidence of cardiovascular risk with testosterone replacement therapy? There have been some retrospective studies, primarily looking at prescription medicine databases, that showed some hint of an increased risk, particularly early in the initiation of treatment with testosterone. Other similar studies did not demonstrate that risk. The key thing to note with those types of studies is that those population studies cannot establish causality. They may be able to demonstrate an association, but they can't show any degree of causality. Having said that, the weight of the overall evidence appears to indicate low risk for testosterone. A number of meta-analyses, which are collections of studies to try to aggregate data, have had conflicting findings, mainly because the included trials in those meta-analyses were not powered to really look at cardiovascular events. the first randomized controlled trial, which is the gold standard for establishing causality in medicine, that is adequately powered to assess cardiovascular event risk related to testosterone, is currently underway. It's called the Traverse trial, and the results are still pending. Based on the current level of evidence, the FDA has released a statement in which they conclude that no evidence for significant cardiovascular risk exists for any given group treated with testosterone replacement therapy. So the nature of medicine and science is to accumulate evidence and to adjust our recommendations accordingly. And we'll continue to do that as more evidence comes out. But for the time being, we feel quite comfortable in recommending testosterone replacement as a means of decreasing mortality due to any cause, just like we talked about earlier. And we certainly lump cardiovascular disease, heart disease, in that, particularly given that heart disease is the leading killer in men and women. So when you're assessing your own risk for heart disease based on your symptoms, your risk factors, your family history, think of your hormones as part of that equation. And we're happy to help decipher that information for you and provide you with recommendations that we think are going to help with your overall health.